Did you know that the number of nurses leaving the workforce each year has been growing at a steady rate from about 40,000 to nearly 80,000 since the pandemic in 2020 and 2019 too? Nurses today are leaving the field at a rapid rate. I believe that this is due to burnout, lack of self-care, and overworking. Hi, I'm Mia Vasquez, and today I'm going to inform you about how nurses are leaving at an astonishing rate. First, we will discuss how they're being underpaid and overworked. Next, I will explain how they're lacking the self-care that is necessary to continue in their daily lives. And finally, I will talk about how understaffing is also causing burnout. The nursing career can be long and stressful. Some days seem like they're a never-ending nightmare, but one must continue through this hardship to make ends meet for their family. There are 24 hours in a day. Nurses are working up to 12 to 16 hours daily right now. This is not giving them enough time to get the recommended 8 hours of sleep plus living their daily lives. A majority of nurses have families. They are not getting enough time to spend with their children and significant others. Nurses are also being underpaid. Nurses will often achieve a higher level of education, a degree or certifications, to be able to work at multiple hospitals and make more money. Often nurses will overwork themselves just to make ends meet, like their responsibilities and bills. It is important for a person to take time for themselves. Today, nurses are lacking the self-care that is necessary to maintain a healthy lifestyle. A majority of nurses are taking work home with them, and that is all they're thinking about how they can take care of their patient better for the next day. This is detrimental to their self-care. They need time to decompress and relax and think about other things besides work. After a long, exhausting day of being a nurse, many nurses are having to stay back and chart because they're not getting enough time throughout their busiest days. With that being said, nurses are also being understaffed. There's not enough nurses to fully staff a hospital for nurses to work less hours. As a nurse, many times they put others before themselves. This is a leading cause for why they're forgetting self-care. It takes a big heart to fill the role of nurse. One must work long hours and sacrifice the times with their loved ones and family and friends to make sure that they give the best of care to their patient. Did you know that more than 47% of nurses are looking to change to an easier specialty? This is due to burnout and overstress in their field. According to Nursing Central, the amount of nurses that are reporting burnout is at an astonishing 95% rate. This is within the first 3 years. Many nurses did not report burnout until 10 to 12 years after they started their career. And according to the University of Virginia today, the nurses' burnout rate has increased drastically since the start of the pandemic, COVID-19. Before the pandemic, it was around 17%, and now it's close to 50%. The nursing specialty that this is affecting the most is the emergency room. This is because this specialty is the specialty that is having to deal with all the incoming trauma. During the peak of COVID, this is where all of the COVID patients went first. This is not giving them enough time to relax and think about themselves. I hope that in this discussion that I have informed everyone on how important this matter that is going on in our world. This is a serious matter that needs to be solved. At some point in your life, you or a loved one will need medical attention, and you will want and do deserve the best of medical care. Again, today I hope I express to you how burnout rate is increasing and how detrimental it is to our society. Nurses are currently leaving at an all-time record low, and if they keep leaving, it can be detrimental to our community. Who will be left to support our community and our hospitals and our patients?